focusing on fitness and your health. Welcome to What's Next, Living Longer, Better, Smarter. This edition is made possible by Get Set Up, a place for active older adults to learn, connect, and share. Find them at getsetup.io. I'm Fred Fishkin, along with Mary Furlong. Hi, Mary.
Hi, Fred. It's great to be here at the beginning of another fall season and our anniversary of 1 year with this podcast.
Into our second year now, and it's a great time to be focused on fitness and health. We have some very knowledgeable guests joining us. Dr. Prentice Taylor is Vice President for Medical Affairs at Doctor On Demand, which provides telehealth services through some of the major health insurance companies. Thanks for being with us, Dr. Taylor.
Glad to be here today.
And joining us from Get Set Up is co-founder Lawrence Cusick. Great to see you, Lawrence.
Good to see you, Fred. Hi, Mary. Great to be a part of this today.
And from Dance for Healing, we're happy to have founder Amy Lee. We're going to turn to you first, Dr. Taylor. We're still in the midst of a pandemic, such a long and difficult time. First, what are your thoughts about the latest news, the FDA recommendation on a third Pfizer vaccine for people 65 and over and others who are at risk?
Well, I would say, having followed the pandemic and also being a practicing physician nationally with telemedicine and seeing people affected by it, that was welcome news. I know that various experts on vaccine safety and effectiveness have anticipated that booster shots would be needed. I do remember seeing Dr. Anthony Fauci on CNBC or CNN or one of those networks probably 6 weeks to 2 months ago being interviewed about this. And we know that the larger thing is that immunity wanes a bit over time with any vaccination. So that was expected with the COVID shots as well. So I would say that the boosters are generally a good thing, and they seem to be effective and safe thus far. I've talked to a number of people who have had them in various categories.
And the other part of the good news there is that younger children, I think from 5 to 11, their Pfizer is applying, I guess, to have the vaccines approved for them too, which is great because a lot of us have kids and grandkids.
Yes, certainly it'll be great to have grandchildren who are relevant to the demographic listening today, the good folks listening today, vaccinated, and will worry less about their health and also them transmitting it to others. So I do anticipate that probably that approval will be forthcoming, at least on an emergency youth authorization basis in terms of those vaccines.
You know, anecdotally, Mary and I have both been seeing more and more people, friends who've contracted COVID, even if they've been vaccinated. So there's a lot of fear out there. Tell us about the role, besides vaccinations, the role that overall health and fitness can play here.
Well, overall health and fitness is important. It's been shown in multiple studies done in multiple countries to affect the effectiveness of the immune system. So your immune system is affected by many things having to do with stress and your overall health. But I would say that we know that exercise, getting some at least walking exercise most days of the week, has beneficial effects on the immune system being able to fight not only viruses, but bacteria. And some think the immune system may help with cancer prevention as well. So in addition, there's nutrition, and we know that there are multiple studies showing the benefits of a Mediterranean type diet, which has a lot of fresh produce, fresh, colorful produce, and emphasizes more things like olive oil in the diet, which can be thought of as a complement and a condiment, is really what I meant to say, a condiment instead of butter. And also eating lean protein sources, plant-based sources, but also lean chicken and fish. So those are some things to keep in mind about how those lifestyle factors are important for preventing infectious diseases generally.
So, Fred, I have a couple of questions because, they talk about the 15 pounds you gain when you go to college, or if you go to Facebook, you gain, 20 pounds and you work so hard. But I think there is this COVID weight gain that happened. And I think part of it was stress and part of it was fear of going out. And I hear there's now a pandemic of obesity that may be over 200 million people, right? I don't know if that's exactly accurate. How much did you see in the calls that you take with people concerned about stress and about losing weight? And now that we've been in it so long, I think everyone's ready to chip the concrete and get that weight off. So have you seen stress and obesity as key issues?
Well, I see them as a little bit separate, but I'm glad you've made a connection as well. A lot of people have been very stressed by this pandemic and all the mask wearing and the guidelines, which are good things. I'm not objecting to those, but it's been the first time in my career, which spans a couple of decades, I've had grown men calling in and video visits, actually weeping during the calls. It's not like there have been dozens and dozens of those, but I've just been struck to see how palpably and demonstrably some people have been affected by stress due to this pandemic. Now, and that pertains to all age categories as well. I've been seeing it, and my colleagues have been seeing it in teenagers and others, college students and others. But going back to obesity, the activity level had been cut down for a lot of people. I myself had been a person who had been used to going to the gym about 4 times a week. And then when the gyms all closed down here in Illinois, where I live, they had to be supplemented by something. So eventually we got some home exercise equipment, but I would say that there's been a difference in the intensity and the duration of exercise in our family. My wife and I have talked about this quite a bit compared to when we were going to gym and in the gym, and it's kind of more competitive, in a sense, when there are other people on the bike or the elliptical or the Stairmaster, the treadmill next to you or close to you, you push yourself differently when you have that group effect of seeing how other people are working out. So there's much to say about that, but the thing that I would say is that this so-called COVID-15, COVID-20 of weight gain is very real. I had experienced 10 pounds of it myself. That I first joke was muscle because I got some weights in the home gym equipment, but then eventually I concluded it wasn't muscle and I needed to just lengthen my workouts to get that down. So there's so much to say about this, but many people have found getting out in the fresh air and walking has been a very inexpensive, affordable way to get some increased exercise and get those at least 7,000 steps a day if you can.
And when you say walking, should people be leisurely about it, or is it more healthy to step up the pace?
Walking at a brisk pace, so you can warm up, but eventually you want to be walking at a pace more like 1, 2, 1, 2, 1, 2, that kind of pace. There are a variety of ways of pacing yourself, but some people say that, walking with a partner and talking is good, but if you can push yourself at some point so that it's hard to keep up a conversation, well, you have your heart rate up and you're really accomplishing something in terms of burning fat. So there's a lot to be said about that.
And if you're out there on the street wearing headphones, keep the volume low or change the settings so you can hear the traffic and everything else around you. Tell our audience a little bit more about Doctor on Demand, what it does, and how much more demand you're seeing during the pandemic.
Well, if I can explain Doctor on Demand in simple terms, Doctor on Demand is a national telemedicine service where we select high quality doctors who pop up in video visits in your device wherever you are. And so that's very convenient for a lot of people because they don't have to go drive across town, sit down in a waiting room, and then wait separately in an exam room to be seen, even if the doctor is on time. And, I did that for years, so I don't want to seem like I'm critical or bashing doctors or the healthcare system, but that's the reality of it. Whereas a lot of people find it very efficient just in general but it was accelerated by the pandemic to be able to connect with the doctor with usually no more than 3 minutes of waiting time, even at peak periods, and generally less time than that. We also offer behavioral health visits. I'm not trying to make this an infomercial for doctor on demand. There are many of these telemedicine services, but I think that one thing that's different about us is that we've trained our primary care physicians to be able to recognize, score, and treat depression and anxiety, because those are so common and so many people are struggling with various levels of stress, concerns, relationship issues that may not have ascended to the full level of a diagnosis of depression or anxiety. So it's something that we integrate. It's not that, we have psychiatrists and psychologists and licensed clinical social workers, and those visits are available in shorter notice that you find in the outside world, but we integrate all of that together, referring patients back and forth. And like I said, the 24-hour availability of primary care physicians who are good communicators, listen well, they're empathetic, and also trained in this is a unique advantage for us.
Very interesting. Turning to you, Lawrence, let's get the big picture first of the great innovation that you're bringing to older adults with Get Set Up. Tell us about it.
Sure. So, Get Set Up is a social learning platform for older adults. And the pandemic has clearly sort of accelerated our business, probably in the same way it has Doctors on Demand. We've seen our demographic, which has historically been relatively isolated at any rate, but the pandemic has really sort of solidified that. So it's becoming even more important to help our demographic learn the basic smart devices, whatever it is they have at home, whether that be smartphone, tablet, iPhone, basic laptop, help them get online so that they can avail themselves of some of these other wonderful services to stay healthy and to stay connected. So, as the name would suggest, we started teaching basic tech to get them online and into their first Zoom class. And then what we found was, they really wanted to take more classes, learn more sort of health literacy, to stay healthy at home, to exercise at home, to cook healthy recipes at home. And so we've felt like we've been able to do some enormous good by first helping them get online and then making them feel comfortable that they can sort of learn, discover, and grow in our classes, whether they be sort of learning a specific sort of meditation technique, managing anxiety, managing chronic illness, or just exercising, doing sort of yoga or whatnot at home. It allows them to not only sort of solve for some loneliness, but stay healthy, while they're quarantining, if you will.
So how does health and fitness fit into this? And also you're providing jobs for fitness instructors, which was an important public service, right?
Exactly. Thank you for mentioning that, Mary. Yes, we think about sort of Get Set Up as being a place where older adults can reskill and upskill, and many of them are retired teachers. They might be also retired, doctors, lawyers, nurses, yoga instructors, because we teach a variety of really interesting categories across the platform. But there's a lot of interesting expertise on the platform around staying healthy, different sort of instructors for yoga, for meditation, for managing even things like chronic illness, diabetes, fall prevention, etc. And so getting experts on the platform to help our audience sort of understand how to think about and how to manage these conditions has been an important part of the work we do. But we do offer an opportunity for those folks to sort of learn and teach on the platform, and they help other older adults learn the things they want or need to live happy, healthy, more connected lives.
And this has been embraced at the government level too, right? Talk a little bit about that.
Sure. We've, amongst our earliest partners, well, we're only about 18 months old, but about 4 months in to our business, when the pandemic did hit, we realized that the area agencies for aging, the cities, and even the state government, sort of Health and Human Services and Medicaid, had a significant need to sort of offer virtual curriculum, particularly health and wellness, to their populations. And so today we now have partnerships with 26 different states at all levels to offer sort of virtual classes, a lot of them sort of health literacy classes to their populations. And so that's been important for our growth, but also to do good work with the states where it's desperately needed.
Sometimes we talk about innovation in this podcast and technology, and Get Set Up is unique in the quality of investors you have behind the company. So out here in Silicon Valley, you have kind of a who's who list. Do you want to mention some of those to the audience?
Sure. We were very blessed to have early investors who came from sort of education, technology, and the healthcare spaces. And that's really helped sort of inform our marketing, our messaging, and the tech platform as we think of better ways to provide sort of frictionless onboarding and education to our older adults. But amongst the early investors were folks like Jerry Yang from Yahoo, founder of Yahoo, Reid Hoffman through Sweat Equity Ventures, founder of LinkedIn, Mark Pincus, the founder of Zynga, and all of them becoming older adults themselves. So, not only investors for the service, but also perhaps future users. And so a great group of folks that have really helped us think through sort of how to grow and scale the platform.
And for your users, a lot of this is done in groups, right? Online?
Well, absolutely. Absolutely. I think the group and community community sort of aspect of this, Fred, has really been quite important because, we like to say that they come for the learning. They actually stay for the socialization, many spending anywhere from a couple of hours a day to sometimes 20 plus hours a week. And so while they're learning interesting new things, the socialization piece has been quite important because a lot of this demographic is now very isolated and very lonely, and that is not at all good for our health, as I'm sure Dr. Taylor can support me on.
Well, that's a perfect opportunity for us to turn to Amy, who's been doing some remarkable things online and in person with Dance for Healing. It's the numeral 4 in Dance for Healing. Amy, give us a quick explanation of what it is.
Yeah, so Dance for Healing is a telehealth platform that powered by patent pending AI to help elders and chronic patients find compatible buddies to build fun, lasting habits together. And our mission really is making happy habit building fun and supportive. And our vision is to be a global technology leader and a global cultural hub to bridge creative arts in healthcare. And it is inspired by my own stage 4 cancer journey, where, that I have to go do, the difficult challenges of isolation, loneliness, stuck at home, that I feel I experience a lot what the elderly people go do. And I was lucky to survive stage 4 cancer. And I just had this strong calling that creative arts really make a difference for me. And there's a lot of clinical study behind it, like this one, helping dementia patients. So I just feel like somebody got to do something, and that person might be me, given that I do have a lot of industry background in innovation, AI research, specialize in human-centered design behavior strategy. So I just feel like I need to do something. And here I am. Yeah.
And we kind of discovered you when you were a finalist in the AARP competition. And I was so impressed with your background because user interface design, making the technology easy to use, is an important part of all of your work, right? But very inspiring, Amy, to take your UI background with a challenge like cancer. So Fred, amazing stories, right?
Really, and the idea, we can start a little conversation with Dr. Taylor here too. You talked about walking and other kinds of exercise, whether people are jumping on a Peloton, whatever. Dance is fun, a fun way to burn those calories. So I'll let you chat maybe a bit with Amy about that.
Well, one thing I wanted to say that earlier when I was listening to Lawrence talk was about the so-called digital divide. And, many people are very fortunate to have all sorts of devices. I think I have 3 Apple devices and just, moved up to current generation. But a lot of people don't have the luxury of those resources. And so the ability for his company to address that, but also listening here to what Amy is talking about, dance isn't necessarily a very expensive thing. You could do that in your living room. You could do that in your basement. You could do that in your backyard. So it makes it more accessible. So I'm interested in what my other 2 panelist colleagues might say about that.
One thing I do wanted to comment though is we just submitted a NIH and also an NSF grant, and then we had to do a lot of study like in the pandemic impacts in the population, and about 3 out of 4 during the pandemic reported 80 to 100% in terms of stress level. It's really high. And then I think 6 out of 10 reported weight gain. And our NSF study is a partnership with Stanford for diabetes patients. As you know, weight gain is a huge concern for diabetes patients. So I know that you mentioned that earlier. I just wanted to emphasize that. Yeah, it's pretty scary. And then in terms of mental health, there's also challenges that in teenagers. I think the data was, I forgot exact data, but maybe 1 out of 4 teenagers have attempted suicide during this pandemic, which is very scary. So our NIH grant will be a proposal intergenerational program to help dementia patients and caregivers, because there's beauty in the intergeneration. You match the young and the old. It's simply a joy to see my niece interact with my mom, and then like she's now moved to New York, she will call my mom every day and report to the grandma, and just like lovely to see that connection, regardless they're in the same space. And yeah.
And I like your line there, get your Nana and Papa to dance. That's terrific. And that ties in with the intergenerational thing. Lawrence, tell us when you're seeing people who are taking advantage of online fitness and health programs, you said they come for the community. That's what they stay for, but there are results as well.
Oh, absolutely, and I think they're mental and physical results, because the very important work that Amy's doing, it brings people together to not only stay healthy, but I think that there's a joy and stress reduction and a release when you're dancing, and particularly if you're able to share it with a group and they're laughing and they're having fun. We have some dance classes on the platform, but we see a lot of sort of singing and music related classes that sometimes end up becoming dance classes. And the other interesting thing that we note is that dancing is really it's a global thing for us, because we started our business in the US and we just expected that US older adults would likely be most of the students. But as we've sort of seen our older adults invite friends, family, loved ones, it's become a very global thing. So we regularly have a singing or a dance class where you'll have Americans, Indians, Malaysians, folks from Australia, New Zealand, from Europe, all in a class together. And it really is quite wonderful to see everybody dancing, enjoying, singing, and having fun. And you realize that you're helping people stay healthy, but there's a real joy and a sense of community that's being created when they come together and do these activities.
I want to go back to what Dr. Taylor said about the digital divide, because we're going to be moving into our Washington Innovation Summit, and we're going to hopefully have Fred interview some of the people who are stakeholders in that conversation. And I have a birthday twin. My birthday's next week. My birthday twin and I will both be 73. But I know how hard it is for her to get out, and I know her broadband access is not the same as mine. And I really think that just like we pay attention to equity of children in school with technology, we have to pay attention to older adults and their access and their ease of use so that they can take advantage of these resources. So it's great to hear that voice at the table. It's great to bring back the music and the jazz and the fun, right, Fred? What a great group of people here.
Really. And Lawrence, we want to mention this. Get Set Up just had a pretty big news announcement, a partnership with Orange County, a $2.4 million initiative to provide iPads and Get Set Up subscriptions to 600,000 eligible older adults in Orange County. Residents will have access to free virtual wellness, online education, social groups, and help them stay connected and active. So that's pretty exciting, addressing, I guess, some of these digital divide issues even.
Yeah, absolutely. You have to solve the first mile problem and get people online. And oftentimes you have to think through sort of connectivity issues, device issues. A lot of our demographic, they may or may not have devices that are ready and prepared. They may not know how to use them. And so we dive in and sort of partner with the local governments to sort of be that first line, if you will. And we have a huge team of sort of older adults who help onboard other older adults, get them familiar with whatever device it is they have at home to get them into that first video class. And if you help them do that, then it sort of opens up a whole new universe of other things that they can do, which is, you know, the other programming sort of on our platform, Amy's. You can use valuable services like Dr. Taylor's. But I think if we can help older adults who need to sort of solve for that initial sort of technical digital divide, if we will, or hesitancy, that's a really important role for us. And we like to partner with organizations that are trying to solve for that at the grassroots level. And oftentimes that is the counties like, you know, Orange County, states of New York, Michigan, Texas, Florida. Those are important for us to help their older adults get enough sort of technical competency so that they can avail themselves of these other important services.
Dr. Taylor, maybe you can address quickly. Anecdotally, I've been hearing that some insurers, health insurers, have seen that their clients have not been able to get to the gym, and now they're pushing people to go and do things online to take advantage of some of these services.
Well, I'm sure that some have. We've seen a variety of initiatives around that. I haven't seen a really good comprehensive initiative, but I would expect that some that specialize in Medicare Advantage, like Humana and probably United Healthcare, would be pushing that. You know, not being, you know, personally a member of a Medicare Advantage plan, I haven't seen that directly myself, but it wouldn't surprise me. So I think those are good things to support and to proliferate. And they have a lot of opportunity to grow the greater good.
I have seen that. I think United now reimburses for a Peloton at home, where you buy the Peloton and they'll reimburse for classes. But you're all doing such important market leading work to make it more fun, to make our seniors more healthy, and to build viable, great businesses, new businesses, innovative ones. So Fred, great session, right?
Absolutely. And we want to thank Dr. Taylor, Dr. On Demand, Lawrence Kosick from Get Set Up, and Amy Lee at Dance for Healing for being with us. Well, Mary, there are some very helpful online sites and gadgets that can really help.
I've been a longtime fan of Spark People. One of my friends was the founder, and that's a great resource to help you make progress. But recently, inspired by one of my colleagues who tried an app called Clinio, Klinio, I tried that as well, and it did a lot of the things that Dr. Taylor talks about in terms of suggesting healthy foods, helping you monitor the amount of water you drink, the amount of steps you take, and then making sure that your BMI goes down so that you don't tip into diabetes. And I think that those are great resources to use. And also just learning to eat healthy and to be more mindful, getting better sleep. And, I think that it was a stressful time. It continues to be a stressful time. And so taking care of your health should be a big priority for all of us, right?
Absolutely. And one thing that Dr. Taylor talked about was just getting out there and walking at a fairly brisk pace. You don't have to hurt yourself. You don't have to stress your knees, your hips, or anything else. Just keep moving and at a brisk pace, what you're comfortable with. Now, I've had a chance to take a look at some interesting health and fitness gadgets. Some of my latest favorites are the Oura Ring, Oura, a very comfortable way to track sleep, activity, and even temperature. Really small. I don't know if you can see it here, but it's just a ring that you wear, and it's got the sensors in it that are very, very sophisticated. The Withings Body Cardio with Vascular Age is a great motivating scale, that really smart scale to give you your body composition, even your vascular age. Don't ask me what the tech is that enables them to do that, but they do. They give you a range of what you're fitting in. And there are so many wearables out there that are worthwhile. The Apple Watch, Fitbit, Samsung's Galaxy Watches. And for only $20, there's one called the Wise Watch. Looks pretty sophisticated. It looks great, but it sells for only $20. It's spelled WYZE. A very nice fitness tracker with a big screen that also does heart rate, blood oxygen level, important during COVID, I think. Does sleep monitoring, steps, more, does the notifications from your smartphone. And the biggest thing, as we said, is that price tag, $20. So it doesn't have to be super expensive, even though it seems pretty rugged, and it's got a battery life of something like 9 days. I don't want to sound like a commercial for them, but essentially it is, I suppose. They do a great job. And so really a worthwhile investment for $20.
Yeah, you can't beat the price. I once tried to start a company called Still Fab for 60 plus women. And it grew out of the fact that a friend of mine was walking down the street in New York, and a friend of hers said, "Wow, you still look fabulous." And we had seen that. We had seen a musical that was, still crazy after all these years. So we thought we should start a website and still be fabulous, because you don't want to say you look healthy. You want to say you look great. You look fabulous. And we want all of our older adults, even those who are 100 or more, to have people walk up to them and say, "Still fab after all these years."
And how appropriate, since you're celebrating a birthday. Happy birthday.
Yes. Well, we keep making it up, right? We have to say, 70 is the new 50, but also it's that vision of the future that we can still be. It's in all of our best interest to create a culture. And I love what Lawrence talked about, of the global image of everyone dancing. You just wanted to join that dance group. So I think what we saw today is real pioneers leading in innovation in health and wellness, and then a shift, maybe because of COVID, to the need to find new ways of staying healthy. And
absolutely. That'll do it for this edition. We want to thank our sponsor, Get Set Up. And of course, we want to thank you for listening or watching. Stay safe and healthy, and remember to subscribe. And remember, you can find us at maryfurlong.com, and you'll find links to our guests who are with us today. There is much more to come.